when I spoke to so many women in the community, even did some research online, pigmentation is the deepest and darkest concern for any Indian woman by majority and by a large way. What is the best way to deal with pigmentation? What skincare helps to reduce pigmentation?
Did you know that the first sign of aging in Indian skin is hyperpigmentation? It's not lines and wrinkles, you know? That's the first sign. And it's also largely genetic. And it's also the fact that we are in the sun along, closer to the sun. The country is situated geographically like that. And then, of course, there's pollution. So there's ozone and all of that, which is not helping in any way. Back in the day, at least, there was clean air, there was less pollution, there was, the ozone depletion was not happening. So our grandparents and all got away with it.
Yeah.
Now, hyperpigmentation is number one. So now I'm going to tell you some 7-8 things which will increase hyperpigmentation, and you'll be shocked.
Okay.
Sun, everybody knows, right? Sunlight, which is visible light, and all the UVA, UVB, light from your laptops and cell phones.
That's
Dark
not good
circles,
news.
That's not good news, because you will get dark circles over a period of time. And as Indians, we are anyway prone to, pigment. We also, if we have eczemas or allergies or anything or an injury, we tend to heal with post-inflammatory hyperpigmentation. So you get a mark. It heals and it leaves a mark in a lot of people.
Yes, of course, now that you say it.
Right? So one is sunlight. The second is sugar. Yes, I told you. So sugar, ages the skin, and it also sort of increases in a lot of people. If you have insulin resistance, it creates a hormonal imbalance. And when I say sugar, I mean sugar in any form. It could be organic jaggery, too much of organic jaggery. Have it in moderation. But it could be jaggery, it could be honey. All of them will be harmful for your skin. So that's the second. Fragrance, right? So fragrance, especially if it is artificial fragrance, even natural to a great extent. And Indians typically, I had this male who kept coming to me. I kept giving him creams. I kept giving him, I said, okay, let's do laser, let's do peel, let's do this, that. Avoid perfume, avoid hair color. All of that happened. Just not improving. So one day, my housekeeper, she lit camphor. We do that so often, right? Kapoor. So, and I told her, you take it away. Don't keep it close to my room. So, and he was with me and he said, why? I said, because I have a tendency to pigment. He said, but I light it in my bedroom all day long. I said, here we go. That's why you're not improving. We stopped that. And then within 6 months, he's improved. So a lot of times the incense sticks, the kapoors, the room diffusers, fragrance will increase the pigmentation, will increase your cells, the melanin content. Yes. And that's a very typical Indian thing. A lot of bhasmas and powders that we use, these Ayurvedic things typically. Mustard oil. A lot of people are allergic to mustard oil, and that is such a common thing. Application of mustard oil. Not everybody will get it, but a lot of them are allergic, and they develop this dark pigment on the face and neck. Hair dye. That has come out now. PPD, which is paraphenylene diamine, in the hair color, causes a lot of allergy and hyperpigmentation. So typically you'll see a band like that. A lot of Indian people have that forehead and then along.
Yeah, of course.
Yeah, and then sometimes it goes on to the neck. And then we have a lot of them using, even Southeast Asians do, but Indians typically are not very lucky here when they use the tiger balms and the amrutanjans and the headache balms. So all of that will irritate the skin and it will cause hyperpigmentation.
I am shocked, literally.
Friction. So when you keep wiping, you see these people on the streets, those who are playing, sweating, the traffic police, wiping constantly, and that friction will take off your take off your protective layer, and then you develop post-inflammatory hyperpigmentation. So these are the various causes. Stress to a major extent will lead to your that factory to produce more cells, more pigment cells. So all of these things, steam sauna.
Please don't say
Yeah.
that.
So if you
I love
are,
a steam sauna.
no, you can do it, but don't overdo it. And if you have a family history where everybody's developing some sort of hyperpigmentation, then don't do it. So I'm not against it. I love steam and sauna too, but I won't sit there every day for like an hour.
Yes.
I probably do it once in 2 weeks for about 10 minutes. So anything in moderation is fine. But if you have hyperpigmentation, these are the things you have to eliminate. And yeah, that's why I said I'm going to shock you, because these are things
Wow.
which they are so much a part of an Indian household.
Absolutely, for sure.
That like an agarbatti, yeah, or a
Yeah.
dhoop or a kapoor. These are basic. Mustard oil, basic. So all of these. And now people are also saying, okay, fine, we won't use hair color, but we'll use henna. But you don't get pure henna. They also add PPD in that. So if you're getting something which is organic, or if you actually take the leaves, and of course that makes your hair very red, there are some PPD free hair colors which are available now. So maybe you can use those. Oh, and one very important thing, loofahs and scrubs and pumice stones. So if you scrub a lot, you develop that band on your arms. It's called amyloidosis, macular amyloidosis. You also develop it on the back. It's like speckled dark, hyperpigmentation. And that happens because of constant friction with your pumice stones or loofahs. So that also should be either avoided or done in moderation.
And how does
And
one
then,
deal with this, right?
yes,
Once it's creeped in.
this is important. Now, answering your question as to what to do about it. So a lot of these serums help, like niacinamide helps. Vitamin C is really good if you have hyperpigmentation. Alpha arbutin is another ingredient that breaks down the pigment and dissipates it. Kojic acid, again, is a very good ingredient. It's obtained from mushrooms, Japanese mushrooms. So, very good ingredient. It's called a tyrosinase inhibitor. Even a vitamin C is a tyrosinase inhibitor. What is tyrosinase? It's an enzyme which helps to produce pigment. So when you block that enzyme, you will not allow hyperpigmentation to occur. So these are the ingredients which you should look out for: vitamin C, kojic acid, alpha arbutin, niacinamide.
But how do I find this in a
Now,
product?
so they're there in serums.
Okay.
So most serums, so if you go in any of these minimalist and ordinary, and then of course the more medicated ones that we talk about, they will all have alpha arbutin, they all have kojic acid, vitamin C, niacinamide. Now, if your pigment is a bit too high, you'll have to consult with the dermatologist, and that is when we also add an alpha hydroxy acid, or sometimes a hydroquinone. Do not do hydroquinone on your own, and do not apply hydroquinone for over 3 months. It's a very potent ingredient for hyperpigmentation. A lot of females get this melasma.
Yes.
It's like a brown butterfly rash on the cheeks and on the nose. And it's either genetic, or it runs in the family. The mother has it, the daughter has it, the grandmother has it, everybody has it. Or it's sun-induced, or it's hormonal. Typically starts during pregnancy. In some, it goes off post-pregnancy. In some, it stays. Once it stays, every minute of sun exposure is going to multiply those cells, and it gets darker and darker. Impossible to treat.
Really?
Yes, very difficult. So it would lighten with whatever you do, but one beach holiday without adequate sun protection, the whole thing will come back. And so you've got to be very, very careful. And so all these ingredients plus hydroquinone, but hydroquinone is typically prescription based. Otherwise, I've seen a patient who back in the day when I had started practice in 2000, I prescribed hydroquinone to her. And I told her 3 months, but I did not write. Okay. I said, okay, this is the cream, use it at night. She kept using it for 2 years. And initially, of course, the entire melasma went away. After 2 years, she came back to me. She didn't realize. She said, "Ye kaam nahi kar raha hai. This cream is not working anymore." And I got the shock of my life. And I'm like, "Why are you using it?" She said, "Because you told me." So what had happened was it develops. So you get a rebound hyperpigmentation, a condition called uchronosis, and that happened. And so she got that, mottled, violet dark, like a brown violet kind of a hue on the skin. And it was pretty dark. And now it happened due to a cream. So
you have to be careful.
You have to be very careful. Now you're okay with using C and niacinamide and, AHA and kojic. That's okay.
Yeah.
Alpha-butene is okay, but not hydroquinone. Not a very strong retinol that you have to ask, like I said, tretinoin. A lot of times I've seen people talk about, oh, hey, I'm using this Retin-A and I'm using Tretin and it's great. It's not great. It's great for them, not for you. Every skin is unique and different.
Absolutely.
Right? So, yeah. Apart from that, it's also very important to supplement yourself when you have hyperpigmentation. So take antioxidants, take vitamin C, take glutathione 500 milligrams. You can take polypodium leucotomus, which is an oral sunscreen. Now, it's not a replacement for a sunscreen, but if you have a lot of outdoor activity, then you take a polypodium leucotomus and you apply a sunscreen. So these supplements will really help, along with the creams that you use in reducing the hyperpigmentation.
So say I'm a woman in my 30s or 40s. I have hyperpigmentation and I don't know how to deal with it. Tell me 3 products that you would recommend.
Names of products, you said?
Yes, please.
Okay.
And they could use any one, but maybe if you could mention 2 or 3.
So I like the Beauty of Jaishree rice water.
Okay.
Yeah. That's a good ingredient to use if you have hyperpigmentation. A vitamin C serum by any, like a Ordinary or a Paula's Choice, or one of my favorite ones like a True Derma vitamin C, or like a La Roche-Posay vitamin C. My favorite is Obagi. I really love Obagi. So any of those vitamin Cs or the other ones, that's number 2. And then the alpha-butene. So the ordinary alpha-butene is very good. You can use that. Now, how do you use all these serums? So first you cleanse your face and then you apply a serum. It's always serum first, then a moisturizer, then a sunscreen if you're using it in the day. The lightest ingredient first. Do not overdo it. Just take about 4 to 5 drops, dab it on the entire face, and then pat it on your face. That's the best way to use a serum. Don't forget your neck. It's not like I'm going to apply 10 drops and I'm going to apply so much that it's going to work more and I'm going to get a better result. It's never like that. Just 4 or 5 drops, more than enough.
So you spoke about rice water, vitamin C, and
alpha-butene.
Alpha-butene. What is the order to use these 3?
Oh, I will never say use all of them together.
So use any one at any given point of time.
So you could do C today, alpha-butene tomorrow, and then you could do the other one, like
okay, and they would always go first.
Yes, they will always go first.
All 3 of them will go first. Then comes your moisturizer. Then comes your sunscreen.
Now, if you have a lot of hyperpigmentation, you can also do 1 in the morning, 1 at night. So if you're doing rice water in the morning, you can do alpha-butene at night.